Welcome to the Dope Black Dads podcast, a place where we are changing the narrative and having progressive conversations about black fathers, as well as creating a safe digital space for the community. This week on the podcast, we'll be discussing coronavirus, the facts, the myths, and how to keep safe. Since we last recorded our podcast on coronavirus, there's been an update. We do know that our Chancellor, Rishi Sunak, has unveiled measures on late Tuesday to do whatever it takes to support the UK economy through a challenging, unprecedented time. The Chancellor said that he is providing £330 billion in loans, which is equivalent to 15% of our GDP as a nation. And it will be available as of next week to help businesses pay for supplies, rent and salaries. Other measures being put in place include extending business rates relief for all firms in the hospitality sector and funding grants of between $10,000 and $25,000 for small businesses. Mortgage lenders will also be able to offer a 3-month holiday for people in financial difficulty as a result of the virus. Help is also on the way for airlines, which have been hit by a huge slump in demand. So there are things constantly happening. Please ensure that you are getting your information from a credible source. We're currently relying on the BBC, World Health Organization, NHS directly for formal updates. There is a lot of misinformation going out there, and I think it's important that we all do our utmost to stay safe. Please, everybody, do whatever it takes. Maintain your hygiene. Please keep in contact with your family, stay away from the elderly and the people who have respiratory illnesses, and also, self-isolate if needed. Thank you all for listening to this podcast. Please share with somebody that has concerns, and do get in touch if you have any additional questions. So this morning, I made a bold attempt to go shopping for my family. As the masculine hero in my house, I thought I'll be the one to risk and face the very difficult world of shopping. We've heard all the rumors about people being particularly aggressive, bulk buying, arguments, elbow shoving. So I thought I'd get there. I got to Aldi in Leighton, give it a shout out. It's the best place to shop, in case you didn't know. They didn't pay for the advert. Get there, the queue for the car park alone. So normally when I arrive on a Saturday, it's you find a parking space, actually in the mums and dads parking space, loads of room to park. Take your time. There's always a trolley. You go in, I go up and down the aisles. But today it was nothing like ever before. When I arrived, the queue was so long to get in a car park. I had to park in some industrial estate next door and walk around. I get in, there is only the limited ability trolleys available, so they are almost twice as wide as a normal trolley. I can only hold 1/5 of the things that you actually need. So I'm walking around this very wide, shallow trolley. I go up my normal path, but as I start to go up the fruit and veg aisle, which was empty by the way, and clearly people are not eating the right foods, I could see this hive of energy 2 aisles down where I know where the toilet rolls are. And a piece of me is this is ridiculous. But I thought, you know what, I'm going to stick to my path. I'm a strong man. I don't need to be susceptible to these messages. I go up and down. I get my fruit and veg. I get the meats for my son. I get the dairies. And I go down the other aisle. Now the gap, so this is a 5-aisle shopping center. The second aisle is stuff that I don't need. But the queue from each till is going all the way down to the very bottom of the supermarket. So it's already manic. And people are trying to get in and out and weave. People are pushing in and all this type of stuff. So I go down the next aisle, which is the toilet rolling. And I was ashamed. I was sad. I walked down the aisle and I saw that there was still some toilet roll, but not the amount that normally is there. And I panicked. And I ended up getting 2 toilet rolls for a week, which doesn't make sense. I was susceptible to the messages. And as I stood there, I was a little bit ashamed while I had my 2 toilet rolls. I'll just let you know that it's 4-quilted, okay? None of that 1-ply stuff. And then went down the aisle. Now, what I normally do is the final aisle I go down is frozen food. Then it goes to baked goods, cereals, and then you go to the till. I'm giving you this for description. So I'm walking down this aisle. There is no frozen food. Previously, there's no pasta. There's no rice. There's nothing pre-made that's like can last longer than a month. Nothing. So all that's gone. So I'm going down this aisle, and there's a really, really long aisle down there, but there's 2 tills. So now we created this scenario where one line was going to 2 tills, and it's an order. If you ever go to a cash machine, people do that sometimes. I get to the bottom of the aisle and do all my shopping, and I'm looking for the best aisle to go down. But the second till on the right hand side has one woman in it, and everyone else is hovering behind. So I was just like, why are no one just joining these 2 queues? So anyway, I'm talking to her like how crazy this is. And then she's like, don't worry about it, just stay here. So obviously I was rushing to come and record this podcast because I'm providing this service for you guys. Did not want to be late. And so I thought, you know what, I will join this queue. So I joined the queue, and then someone tries to pull me up on it. And she jumps in and goes, oh, no, he's with me. It's the first time I've claimed a woman that's not my wife in our marriage. And I'm sorry, Nina, but it was for the better good of our family. So I've joined this queue now, and everyone's looking at me like, don't think that's true, but can't really fault it. So I'm there, and then another lady joins behind me, and people now know that she's not with us. They know. And so this English guy starts yelling at her, calling her stupid. Do you not see how the queue system's going? It gets a little bit spicy, bordering racial. I was very disappointed in this man. So I interjected because I'm a dope black dad. That's what we do. We allow no injustice to coincide with our presence. And it's just really interesting watching how Britain implodes when I won't call it small, because people are dying. When something happens in such as infancy, we don't really know what's going on. But everybody's reacting like we are already in the end of the world. And that's the problem. But I thought, you know what? Let's not live in the dark ages. Let's get information. So I've got Mary with me, who's a specialist practitioner in the NHS, to come and demystify some of these questions around coronavirus and hopefully give us just a little bit of context so we can just not panic as much, but be mindful. So Mary, in your view, what are the facts? What do we know? What's being assumed? What's the misinformation? Are you able to give us some insight into that?
Yeah, thank you. Thanks, Marvin. Thanks for having me. I think let's start from the basics. What are viruses? Viruses are the most common biological entity. And scientists have discovered that if we line them up, they'll go from one galaxy to the other.
Wow.
So that tells me that they live with us, in us, about us. We encounter them every day. But they are in groups. Some are even, around. You encounter them every day, but you develop immunity against them. Some will make you ill for some time, and some are deadly.
Right. So is there examples of those 3 different groups? I assume the one that you have and heal in a few days' time is like a flu or cold.
Yeah. So let's talk about corona. Coronaviruses are many. So this particular species of coronavirus causes COVID-19. It's the same coronavirus that caused Ebola.
Right.
The same coronavirus, SARS. And when we think about these things, we think they've come, they've done the damage, they've gone. Some of them become endemic. People are still dying of SARS more than COVID.
Really?
Yes.
Where though?
Yes. The latest statistics as at 9th March, that may have changed. COVID in mortality comes to number 15. 52 people globally are dying every day. And on top, we have the others, where people die in their thousands every day globally.
Wow.
Okay, so when we put that into context, we see that, yes, we should be afraid, but the fear is overblown. And we had this interesting discussion before we started. Why is it so overblown? Because we had bird flu and people didn't shut down because of it. Social media.
Interesting.
You open your WhatsApp, you get like 4 videos from trusted friends and family. Please do this, don't do that, don't do this. And unfortunately for me, these people claim to have MD and other titles behind them, some of the people making the videos. So people immediately trust them. Like on my social media platform, the only thing I've put there is, please take your information from reliable sources.
Yeah.
NHS, WHO, people you know will not lie to you. They will not hype it. But here's the other side of it. If they don't hype it, it's not news.
Yeah.
You know, we have so many wannabes. Okay, so that's why there's this panic buy. The other side to people being aware is that now, even the public places, they are doing something that really saddens me. And which I'm going to, refer to Public Health England on. You go to the banks, they are wearing gloves.
Right.
You go to the airport, the people checking you in are wearing gloves. These gloves are single-use gloves.
Right.
And they use them, they wear them for like 10, 20, X number of customers.
Yeah.
Okay, let's analyze this. If you served 15 customers, for instance, and they're fine, and I'm going to go to how the viruses generally and coronavirus are transmitted in a minute. So your 15th customer has got the bugs. Gives you their passport or ATM card or whatever. You touch it with your nice gloves. You touch your gloves with your keyboard. You give it to them. Customer 16 comes in. Now, viruses does not survive. They don't survive on their own. When they're in the atmosphere, once the viron, which is their protective shell, goes away, they die.
Right.
It's only if you contact them before the viron dies that they enter you through,
right.
outlet. You become another host.
Yeah.
So if customer 16 comes in, viron's still very much alive on the super gloves. ATM, passport, touchy, give it to them. They, put it there, rub their nose, their eyes, they get it.
Yeah.
So in a way, while the government are doing their best to contain and to educate, the
practices are still flawed.
They are actually more or less putting us in danger.
Yeah.
So it doesn't matter the number of toilet rolls or frozen food or pre-packed foods you buy.
Yeah.
If, public education is not widely available, like you are doing here right now, educating, the listeners and everything, then we are even in more danger. Because the viruses, once they go in, they attach into the human cell, and then they make their homes there, they divide. What causes the problem actually is as they come out of a healthy cell into another cell, that cell dies.
Right.
So in no time, they kill as many healthy cells as possible while they are, mutating or multiplying. Now, with coronavirus, experts have discovered that it can actually mutate and change to something else.
Right. So
for treatment, vaccination, they need to come up with something that will actually address that. The other aspect to that is that people who's got underlying conditions, high blood pressure, cardiac diseases, diabetes, especially chronic obstructive airway diseases, because already their lungs are compromised.
So like asthma and those sort of things, pneumonia.
Respiratory problems. So when they're going, because coronaviruses are mainly respiratory viruses, they attack the already low immunity and then they make it lower, they make them susceptible. There's something we call comorbidity. So these patients are prone to, problems already.
Yeah.
And now the viruses come and then, it attacks them. So what do we do? The first and foremost is we should do what we should always do without an outbreak. Hygiene. Wash your hands. Wet your hands before you wash them. If you come out from wet your hands, then do the soap and rub your hands together. Not do the 6 steps that we do in the hospital, but rub your hands together. Make sure everywhere is covered and rinse thoroughly. Because if you leave soap debris behind, then it's not really clean.
Right.
And then dry thoroughly as well. Right. Let me go to hand sanitizers. If the alcohol content is less than 50, it's a waste of money.
Right. Okay.
Yeah. Because it will not be that effective.
Cause I've used people's hand sanitizer and it's the Carex kind of like
Yeah, exactly.
Nonsense. Sorry,
Yeah.
Carex, but
Yeah, I know. Yeah, I'm guilty of that as well. I have some with aloe vera.
yeah.
No, it's just something they put in it to attract us ladies. You know?
So Mary, what if someone thinks they have the virus? What is there a suggested method or path that you do?
Yeah, so if you're having the symptoms like coughing, like temperature, high temperature, and it's not the one-off temperature, one-off cough, if it's consistent and you haven't had it before and you're worried, the advice is to stay away.
Right.
And again, this, is to reassure people that it's another virus, deadly as the other 3 or 4 that we've had that are now living with us.
Yeah.
And experts think this one might live with us as well, or it may go away completely.
Right. Okay.
So stay away for 7 days.
Right.
And after 7 days, the advice is that you call 111. But 111 is not your first port of call. Your first port of call is to stay away. Isolate yourself. As we do in the hospital, we call it cohorting. That's for a group of people in a ward or a space. So at home, you isolate yourself and watch the symptoms. But if the symptoms gets worse before the 7th day, don't wait till 7 days.
Right. Okay.
But if it's mild, I'm still having this irritating cough for my temperature was 39 yesterday, it's 37 today, it's 40 tomorrow, let's say, then you can stay. You can do that self-isolation. And you know that even on a good day, self-isolation is not a good thing. So if you find yourself in that situation, my advice would be to get as much bottles of water or whatever with you in the room. Have your book, have a charging point for your phone, your iPad. If you are like me, have your CD player. And so something that keeps your mind alive and that keeps you away from, oh my God, I'm going to die in 2 hours.
Yeah.
And if possible, try to avoid all these channels that we're talking about. Because
for information,
if you are in isolation and you're coughing, you're having, high temperature, and somebody says, 3 people coughed in whatever, and 2 of them is dead now. You'll go crazy. And you get even worse. Because suddenly your cough will become tuberculosis. Which is a cry for help rather than the symptom of tuberculosis. So something to keep you occupied. And again, this is where the community comes in. Yes, I mean, friends can call, family can knock the door. Are you okay? And the thing is, I mean, these viruses, they spread through shedding, through coughing, through sneezing, not by staying, like few meters away from somebody who thinks they are ill. So don't let us lock them up and,
forget them.
Speak through the keyhole.
It's not one of those. Is there a different approach for children? I know there seems to be higher reach in elderlies, but is there a different thing around children?
No, there's nothing different actually. And the indications, the research, the observation, like you said, have shown that children are not very much affected in this as much as pregnant women as well. Only one pregnant woman has passed it to an unborn child. And
really?
And the study is very small, so it's not conclusive. So, but like everything else, I go back to what we should be doing every day without an outbreak. Keep the children safe. Make sure, they maintain the hygiene, wash their hands. If they have even simple cough, cover their mouths. Check them, because children can sometimes not tell when they are ill. And maybe this is why the statistics are skewed as well as to the number of children affected. So take the time to check their temperature, even without thermometer, the neck, the chest, the back. Is it hot? Are you okay? Are you, just to be sure, and hydrate them as well.
And so just speaking to that, so the advice around closing schools and not closing schools, we know in Ireland, France, Italy, they've closed schools. Do you have a view on what we should be doing in Britain? Not to necessarily go directly against Boris, but
so closing schools, closing workplaces is all based on the cycle, and it's all based on the method of reporting. Because it's difficult to know who's got the virus until they are diagnosed. Then different approaches will be put in place
Yeah.
I know that some countries actually go the route of quarantine, which is like closing the schools. But the UK government have said that their response will depend on the severity, the region, and what's going on.
Right.
So let's say in London, Southeast, for instance, we've had, for the sake of argument, 100 confirmed cases or 50 confirmed cases and other with the virus. Okay, we might say, actually, this number in 1 month is too much. Let's start closing schools.
Right. Okay.
That doesn't mean the whole of
Yes.
UK or London should close their schools. So it should depend on the severity, the region, and what's going on.
And whatever measurements they
exactly.
decided
Like
is too
there was
high.
a school I read that, one of the children just came back from holiday and of course, straight away, close school. Because you don't know how many that child has been in contact with.
Yeah.
You don't know, who is incubating, because the viruses have incubation period, which is why they advise people to stay away for 7 days. So we don't know who is incubating right now. And so we leave that to the government for their next step. And usually when something comes up like the particular coronavirus that is causing COVID-19, what we do is we step up our games, if you like. We always have something in place anyway for an outbreak. So we go back to the drawing board and say, this particular one, will our previous steps work? Will our previous measures work? Do we have enough, medical personnel to cope with this if it goes this stage? And people continue to study and come out with answers.
That makes sense. And so is there a particular advice if you're dealing with elderly people from a professional point of view, or if you're visiting elderly people? Because I know they're extremely more susceptible than others, but some people have been said that they're not able to see their grandparents. Or is that true? Is that worth doing?
Yeah, I'll say if they have underlying conditions like kidney problems, cardiac problems, airway problems, I'll say unless you're certain that you haven't got the virus, stay away from them. Okay, because if you are incubating and you don't know, and you go to them, you put them at risk.
Yeah.
We can make other arrangements for them, but not ignore them completely. Maybe just stay away for the 7 days if you just come from somewhere, or you think you have the symptom or something like that. But not ignore them completely. Yeah. And I'm sure, everything has a cycle. And this one at a point, because I had some people yesterday say, having a conversation with the cashier at the supermarket who's wearing gloves for 100 people and saying, food trolley, I'm buying few things in case the government says we should all stay at home. And I had my 2-liter bottle of milk, the only one in my hands. And I'm thinking, okay, just like you, I'm thinking, okay, 1 bottle of milk, food trolley, stay home. And the girl said, the other one said, it's because I don't want the children to be home and starve. Okay, mine will starve. Okay, all right. You know, so these perceptions, we need to be able to help people to say, no, don't ignore your family. Don't blow it out of proportion. I don't think the government will ask the whole of Britain to stay at home, or the supermarkets will run out of supplies.
Yeah. So, I think, are there any foods or medicines? So, like if you get in a common cold, they'll be like, take ginger, lemon, and some honey and you'll feel better. Like, is there any foods that can help you with this?
So I go back to the fact that it's a virus, and the fatality rate have been put between 2 to 3%. When we had SARS, it was 10. The Middle East one was 37.
Damn.
Yeah. So you can see that anything that you will do to keep the regular viruses away, you continue to do. Build your immunity, vitamin C, orange, fruits and things like that. And few hours ago, about a day ago, I understand that scientists have come up with some medication, which is good news for Nigeria.
Yay.
Chloroquine.
What is it called?
chloroquine.
What is it?
And I said, good news for Nigeria, because malaria is endemic in Nigeria, and they use lots of chloroquine anyway. So it wasn't discovered in Nigeria, no.
But it's one of those ones that, like, historically in the country, everyone has it.
Yes. So now they've discovered that 5 milligrams of chloroquine plus, I think, 10 milligrams of zinc, I'm not sure, but it's chloroquine, combination of chloroquine and zinc can keep the viruses at bay.
Yeah.
Yeah.
Because my mother-in-law
Only
said
like-
that zinc is very good for, like, trapping the viruses before it goes down into your actual system.
Yeah.
Interesting.
Yeah. So fingers crossed. I mean, if that works long term, and so it means the answer is on our fingertips, actually, because chloroquine is readily available, zinc is readily available, just the farmer to put the combination together, and for some of the viruses, they couldn't even find a vaccine or medication for it before they go away. Yeah, so I mean, this is how many months into it, and people are actually having some breakthrough.
And so, what would you say your sort of advice? If I'm self-isolating, how is there any advice you would give to kind of maintain my? I know you touched on it earlier, but just to maintain my sanity, as it were, because it's quite a difficult thing to be on your own with that type of thought. Is there any advice you would give mentally? Yeah.
So the first thing to do is to accept it. Okay. You have to say to yourself, I'm doing this for my own good. It is good for me. And this is when I draw the line. If you think the cough has subsided and the temperature is gone away for the past how many hours, 2 days or so, and you want to have a bit of fresh air, please do. You can open your front door, wash your hands, and then come back. Maybe go back to the room for another day or so. But the first step is acceptance. Once you've accepted it, put your own plans in place. Some of the things I mentioned, what works for you. If doing away with your phone will work for you, do away with your phone. That's where, you shut yourself from, all these things. If, sleeping is good for you, do sleep. But once you are mentally prepared to say, okay, I'm doing this for me, not because of the noise, and this is how far I'll go, and this is what I do to keep me happy, then that should be good.
Yeah, that makes sense. And then just in terms of quick fixes to improve your immune system. So we mentioned, what was the product that you said mentioned? Is it Covix, or what's it called? With zinc and something else?
Chloroquine.
Chloroquine, sorry. Yeah. Is there any other, just in general, just to improve your immune system? Because it's funny, because my kids had just before Corona came, they had a fever anyway. They had a week each where they were not particularly well.
Yeah.
And so is there anything just in general just to keep your...
Vitamin D is very good, underestimated, very good, and very cheap.
Is it found in anything else, or is it just you buy it individually, or is it found in certain things?
It's found in fruits, you find in some foods, but the supplement is good because, especially here in the UK, we don't have that many months of sun.
Okay, yeah.
So sometimes you realize that some of the illnesses are not actually, you look into it, why am I feeling this, why am I feeling that? They put you on vitamin D. Sometimes they start with a high dosage, and then you go to, the ones you buy on the counter, and you feel better. Yeah.
It's really sad because I think I read a story, the BBC News picked it up afterwards, about people being racist towards Chinese people or Asian people now because they feel like they brought this to their great country and it's their fault. Like, what, from a human level, just like what would you say to those people and the people that are receiving the abuse as well? Yeah,
I'll say it's not nice, it's not fair, it's nobody's fault. These coronaviruses, they live in animals, they live in bats mainly. This one was from bats, and I think the Ebola ones was from bats as well. And yes, we all have our shortcomings, but that government in that country should address that. Yeah. Address the sanitation, address the hygienic situation, have more strict about policies in place about food handling, food display, consumption, and things like that. I mean, I've just come back to the UK like a month ago, and I had a similar experience. And then the hostess came to me and said, "Do you want to move?" And I said, "No." it's no problem. Because if these masks protect them, not you. It's not going to do anything to you. Research have proven that. In the times I've been in theater, and I feel sorry because I see people wearing them for hours on end. Even as a practitioner, I can only wear them for certain amount of time. So it's not fair. It's personal how, whether you want to sit. Okay, for instance, you sit beside somebody in the train or on the bus or whatever, they start coughing. If they are not Chinese, what are you going to do? So I think that's bad practice and it shouldn't continue.
So we have a couple of questions from the wider .black community. Firstly, someone said, so what happens now and how long do you see this going on for?
Okay, so everything is pointing to containment and treatment. And like I said, they found a kind of treatment. So hopefully they start, taking that out. The experts, epidemiologists and scientists are saying few moments will know whether it will be endemic, that is, it's here to stay. But because the fatality rate is low comparatively, once the hypes goes down, then we'll be able to put things in perspective.
Right, okay.
So it will either go the way of X number of people are dying, even those who haven't traveled or whatever, or it's settled down now, the death rate is as low, maybe even lower than 2%, but we're still going to be dealing with it like SARS, like flu,
because people are still dying. And what do you think of the UK's government's contingency plan in comparison to other nations? How would you rate it?
Like I said, they always have things in place. That's why it looks like they're not doing much, because there's always things in place for coping with outbreaks. So what they do is when something, they call it novel, like coronavirus, it only means new. So when something new comes in, they reassess, they reevaluate, then they move it up. As it gets more serious and things like that. But for me, what I think should be clear, you ask people to stay away for 7 days. If you work with the government, you get paid. Now they said they pay them from day 1 instead of day 4. That's fine. If you're a freelancer, they said claim universal credit. We know the process to that.
It's killed more people as it.
Exactly. If you're a private enterprise, what do? Although they said they give them some support, but that would depend on, how humane your employers are. So I think, they should be clear on that. And also, Public Health England need to address some of the myths.
Yes.
It should come from them. This is right, this is wrong, don't do this, don't listen to this. Then focus will shift from everything from social media and wearing gloves to serve 100 customers to,
into a
Public Health is saying this. Public Health England is saying this. And that will make a difference.
And so is it worse being on public transport? Is it worse underground or on the bus? Should you just avoid public transport? What's your view on buses and trains?
Okay, as long as people, now we have to come together as a community. Okay, as long as people are doing their part, it shouldn't be too difficult. Like I said, these viruses don't survive when they are down. They survive for a period of time once they are down. So if you cough, you cover your mouth and face or with your sleeves or whatever. If you itch yourself, make sure it goes into your dress, not all over the place. Unless people are actually going out of their way to blow out these, viruses.
Like sneeze in the open.
Exactly, hoping it will go in the air. I don't think there's that much danger in public places. Of course, there is danger in the sense that you don't know who's going through the incubation period until they've got the disease. But that shouldn't stop us from, traveling.
Amazing. And the last one we got is that what role does a mask play and does it actually prevent you from getting the virus?
Like I said, it does not prevent you from getting the virus. It prevents the host from spreading, from sharing the virus. So when they sneeze, it stays in the mask. That is, if they're wearing the proper ones.
Of course, yeah. Because some people are wearing ones with gaps and holes in it.
Yeah, exactly. So if you wear like the flimsy paper mask that's supposed, just like the gloves, I keep going to the gloves, they're supposed to be thrown like how many hours, and they're on you for a day or whatever. Once you sneeze, it will be wet, and then
you're supposed to get rid of it at that point and start again.
Yeah.
Okay. Yeah. That's good to know.
And even there's the potential that the minute it's wet, the virus may have, some of them may have escaped.
Yeah.
So it has to be proper ones. In the hospital, we have special masks for tuberculosis, special masks for HIV/AIDS, So
people are wearing the kind of like the loose ones that you wear like for surgery, like the costume ones that you would wear to say that I'm a surgeon, and they're not there to capture anything. Really.
No. Yeah. So,
okay. Mary, thank you so much for joining us. That was so helpful. Even some of the things that I thought I knew very clearly, I didn't. And it's actually made me feel a lot more relaxed. So where can people connect with you online, or where can we find out more about the work you're doing?
Okay. So I'm also the founder of Zenith Global Health.
Amazing.
Which is a platform for collaboration, teaching, training, and award ceremony for healthcare professionals globally. Amazing. So on LinkedIn, Mary Akongbe, Twitter @Health Icon, which is the Zenith Global Health.
Amazing.
So Zenith Global Health generally. Our next ceremony is in October here in the UK, and for the first time we are having Zenith Global Health in Africa as well.
Wow. Congratulations.
So thank you.
That sounds amazing. Well, look, thank you so much for listening to the podcast. Don't forget to rate, subscribe the podcast wherever you get your podcast.